the clients that provoke a strong emotional response in you, regardless of what their diagnosis is. I think this has been incredibly useful to help me understand and manage.
It's actually gave a bit more confidence in working with those patients that we maybe keep more at arm's length, if I can say that.
I guess like a lot of those clients that are in and out of our services, we feel a bit stuck with them and we don't know where we're going with them. And I'm sure they also feel stuck. Like, I'm sure it's distressing for them to feel that nobody knows what to do with them and what's going to help.
It's a lovely course, but it's been at least 25 years since I looked at anything academic. So for me, it was daunting, a bit frightening. And I thought, what have I got myself into? But I'm here at the end, so yeah.
It probably took me at least a couple of training days and supervisions before it kind of clicked for me. So I guess I'd just say hang in there if you find yourself in the same boat to start off with.
I found the supervision was really useful because whilst we're all CMHT in the one trust, we work in different areas. So it's good for building relationships, but also hearing how Kathy and Ruben would approach scenarios makes me think about how I could maybe approach things differently.
For me, the mapping was transformative. It's some way magical. The use of the cards for patients to help them name their emotions, to help them feel it, and then there was just this shift where you sat alongside your patient and felt it and helped it move along. Was fascinating, really insightful.
Looking at the patterns, bringing that back, discussing that with the team. And looking at the team dynamics and how we are feeding a pattern. You know, how as a service we can feed patterns for patients.
I think everybody needs to be trained in it in our team. Everybody needs to do the CAT skills, but I do think everybody in community mental health teams, there should be at least one CAT therapist, so that we can conduct really good, solid, robust interventions in Tier 3 services.
And I think even other services being trained in this, like we found it so helpful for community mental health team. Like, we're such advocates of wanting everybody in the team to have done this training because it's completely shifted our mindsets, but we want that for other services. Like, we want that for home treatment team, we want it for the assessment centre, acute wards, because I think it just completely transforms how you care for patients and also for your own self-care benefits. You know, it's reducing burnout because when you can understand why patterns are occurring and you can actually step in to try and break those patterns, it's such a relief of, you know, these aren't going to be patients that are going to be in and out of services forever. Like, there is a way out for them and for them to have like a good quality of life. So I guess, we definitely want more people to be trained in it.